Again, welcome everyone. This is our first virtual meeting, so I hope everyone is going to be patient with us as we work through this. But I think it's going to be an effective tool for us to use going forward as well. Just by way of background, I think most of you probably know me. My name is Fred VITA, and I'm the facilitator for the Human Services Alliance. The Alliance is a network of about 120 organizations across Beaufort County and actually across the Lowcountry that are all involved in some aspect of quality of life in our community. We have been organized into a framework that we call Together for Beaufort County, so that all of the various members of the Alliance are networked into different work groups or coalitions or alliances. They go by different names. But essentially, they come down to the same thing: committees of people working to have an impact. Our website. So if you need more information about the Alliance or about Together for Beaufort County, please check out our website on the Beaufort County page. You can get all the information that you need there. Also, after today's presentation, the meeting will be recorded and posted to the website, so you'll be able to go back at any time and re-watch how the process worked. This will also be great for our coalitions because they will be able to go and capture out their clip from today's presentation and then use that for grant applications or for introductions to new partners and so forth. One of the advantages of being a member of the Alliance is that you have access to grant funds that are awarded to us by the County Council Community Services Committee. Every year they allocate a set of funds for us to use in a grants process. And we administer that grants process for the county. The grants were due end of last month, and we intend to present the recommendations for funding to the Community Services Committee on Monday, October 5th at their meeting. That will then lead to, if they are approved, that will lead to them being presented at the County Council meeting at the end of October. And if County Council approves, then the checks will go out in November. We also have a new registration process. So if you have not registered to become a member of the Alliance, and if you have just been a member in the past, but have not used the new process, the new registration process, I'd ask that you do that. Ben's going to provide a link for that so that you'll be able to click on it and it'll take you to the registration form. There it is now in the chat window. And that will help us to get a better handle on a lot of the demographics around the membership within the Alliance. So that'll be really helpful for us if you would do that, if your agency is not already on it. Let's see, looking at my notes. Next thing is that we've made some changes to our Alliance newsletter, you may have noticed. So based on feedback that we've received over the last several months of having to use the newsletter to try to get information out around COVID and a lot of to reduce the newsletter down to primarily that relates to Alliance news, and then any critical items that individual partners are dealing with. So if you feel like you have an item that needs to be included in the newsletter, contact Ben, and he can discuss with you how we can go about doing that. But we realized that a lot of information is already being shared by various groups through their own newsletters, and so it got to be very duplicative for us to be putting that same information in our newsletter. Lastly, before we get started with our first presenter, I'd like to encourage everybody to if you're not a member of a coalition, after today's presentation, you'll have an opportunity to see all of the coalitions that we have as a part of Together for Beaufort County. And so I'd like to ask you to think about how you might be able to partner with us and decide which one of the coalitions you're interested in working with. Just contact Ben at that point, and he can put you in touch with the facilitator or the chair of the various coalitions that we have so that you can go forward and get connected with their meeting schedule and get up to date on what they're working on. All right, I think we're ready for our first presenter. Al, can you give me the next slide so I can see? Oh, okay. Well, that was the that was what I just went down. This is the agenda for today's meeting. So that was the virtual overview and the news and updates. So we're ready to begin the presentation. So our first will be the Abuse Prevention Coalition, and we have James Morale, who will be presenting that. Also, just so everybody is aware, your videos and your microphones are off by default, so don't bother trying to change them. We're up to almost 90 participants right now, and that would be really difficult if everybody was trying to be heard and ask questions and so forth. So if you have any questions, simply type them into the chat box, and we have a moderator who will be watching that chat box and will pass the questions along to the appropriate speaker once you type them in. So James, can we ask you to start up on the, and Alec, if you'll go to the next slide, please. Next slide. And one more. Oh, keep going. And keep going. There we go. Okay, you're up, James. Go ahead.
All right, good deal. Well, thank you, Fred. Thanks to everyone that's on the call this morning and those who may be watching this as well. Appreciate the opportunity to talk about the Abuse Prevention Coalition. So the Abuse Prevention Coalition is comprised of CAPA, which is the Child Abuse Prevention Association, who focuses on the well-being of children everywhere, and Hopeful Horizons, which we are a local children's advocacy center, domestic violence and rape crisis center. So the two organizations came together in 2009 for the purpose of strengthening our collaborative efforts by pooling resources to invest in primary prevention to address the gap in prevention services in Beaufort County. So our mission is to change the culture of violence by educating the youth or the next generation of leaders just to make the world a safer and more equitable place. And the vision of the Abuse Prevention Coalition is an equitable society free from violence. And so most people are familiar with the work that CAPA and Hopeful Horizons does, and understanding that there are certainly, we see clients and we see community members and cross intersectionality all the time. The agencies decided to come together and really try to focus on prevention efforts. So what we do is we look at a structured way in trying to change the culture of violence by, again, providing primary education and programs where we focus on middle school and high school age children, as well as programming for elementary students as well. And how we do that is we have a strong focus, again, on working with the youth just as a way to prevent and build a better future. So we work with lots of community partners to provide primary education and to focus on how best can we serve the youth in particular in Beaufort County to focus again on changing the culture of violence for those in the future. So since the initial start of the Abuse Prevention Coalition, we've been focused on expanding not only our programs, but our partnerships and the coalition itself. So in addition to Hopeful Horizons and CAPA, Beaufort County School District officially serves as a member of the organization as of this year as well. And so that natural involvement with Beaufort County School District is a big win for the students that we serve, that offers an opportunity for us to collaborate with staff across the district to offer more targeted programs for those students. Additionally, we're also looking to involve and engage with reps from Colleton County School District, Hampton County School Districts, as well as Jasper County School Districts. The agency, the coalition itself, we serve students across all four of those counties: Beaufort County, Colleton County, Hampton County, as well as Jasper County, in lots of different ways. And so throughout this pandemic, one of the questions that was asked was to really just kind of talk about some of the things that we've been doing this particular year. Certainly this year has been challenging. I don't have to tell anybody that. But we've continued to meet and plan for youth engagement this year. We've engaged so far with over 200 students pre and post pandemic. So even when we had to quarantine, what we did was quickly try to figure out ways that we can implement our programs virtually so that we can still have engagement with students across the board. We've held virtual trainings for Beaufort County School District students, for TCL's Talent Search students, as well as students from the Bluffton Boys and Girls Club summer program and other programs as well. So we don't just have a focus on schools, but we have a focus on the youth as an overarching goal. And so we work with any youth serving organizations, and certainly in the schools, that's one of our primary target areas of focus. We've also hired a new violence prevention specialist with whom that's one of the people who are charged with going into the schools under the auspices of the Abuse Prevention Coalition. And we've trained that new facilitator in an evidence-based curriculum from One Circle Foundation. And then again, lastly, we brought on Beaufort County School District as a coalition member. Now, we use evidence-based curriculum for all of the programs that we offer. So there's things like the Men of Strength Club that we offer, Mentors in Violence Prevention Program, Girls Circle, the Council for Boys and Young Men, Coaching Boys into Men. So we have a number of different evidence-based programs that we implement as we work with the students and the youth in our programs. And so again, the Abuse Prevention Coalition is just really looking to expand our reach into primary violence prevention across the board, not just with the focus on domestic violence or child abuse in particular, because what we understand is that all forms of violence are interconnected, and so we have a focus on violence prevention as a whole. We've just continued to move forward, continue to offer services virtually, and currently, as I speak, we have our violence prevention specialists engaging with schools throughout the four counties that I mentioned to continue to offer prevention-based programs to all the students. And all of the service that we offer are free. If there's ever any opportunity where we can speak to a group of youth, whether it's in school, in churches, and community organizations, give us a call, reach out to us, because we have trained facilitators that are focused on engaging and implementing programs with youth, again, focused on violence prevention, things like bullying, leadership, sexual harassment, and all sorts of different topics that we focus on with our youth. So we're continuing to move forward. We look forward to any engagement, and if anyone has any questions, you can certainly reach out to any of us. Most people know how to reach out to us either at Hope for Horizons and or Kappa. But certainly, I serve as the chair of the Abuse Prevention Coalition. And so, I work, I'm James Morale. I work for Hope for Horizons. I'm the director of prevention and outreach. And so you certainly can reach out to me if you have any further questions. Thank you all for the opportunity to talk about preventing violence in the future.
Thanks, James. Okay, coming up next, we have the AccessHealth Lowcountry and Debbie Slazik. Debbie, if you will, make sure that as you want the presentation to proceed, that you just say next slide so that the moderator knows to switch you to the next slide. Alec, if you'll bring up the next slide, please. Okay, Debbie, you're up. Debbie Slazik?
Yes, good morning. I think I'm still muted.
Nope, I can hear you.
Oh, perfect. All right,
And we
good
can
morning, everybody. Thank you for taking the time and effort to pull all of this together, to Fred and Ben. I know we've missed our partnerships and seeing everybody in person, but virtual is the next best thing. So AccessHealth Lowcountry is a collaborative that works to bring healthcare free or at reduced cost to low-income uninsured adults in Beaufort, Jasper, and soon to be Hampton County. We recently submitted a new grant application to the Duke Endowment, who's our major funder, and we've asked to expand formally to Hampton County, where about 10% of our clients now come from. So Access Health, we began our year with, we've had 2 meetings so far in 2020. The first was in January. Next slide, please. And we had hosted South Carolina DHEC to do a data walk through Beaufort and Jasper and Hampton counties. Essentially, the chronic disease epidemiology group created posters and calculated data trends from 2012 up through 2018 for Beaufort, Jasper, and Hampton counties. We looked at 8 categories of demographic and health data, and more than 50 people attended the event. The information was very impactful, and I think it's really served to elevate our shared understanding of the challenges and disparities within our community. This was also very timely because with the onset of COVID, the disparities we see here in Beaufort, Jasper, and Hampton counties are also being recognized and acknowledged at the national level. So this data walk will set the pace and set some of the priorities for the coalition in the different chronic disease categories we're trying to tackle as a group as we move forward through the next couple of years. Second meeting we had was in June, and we gave everyone an opportunity to just share the status of where they're at. Next slide, please. So, like for many of you, COVID-19 had a tremendous impact on what we do as a coalition. Again, our primary thrust is to get people set up with primary care and specialty care and navigate them through the healthcare system and address the various social determinants of health, including prescription assistance and transportation assistance. And while many of our partners closed or reduced their services during between March and mid-June, people have now been reopened. I have to say, in talking with all of our partners, all of them tended to use this as an opportunity to move forward and embrace greater technology. Free clinics and Beaufort Jasper Comp Health and Beaufort Memorial Physician Practices all rolled out or expanded telehealth into their clinics, worked with patients to get the technology on their cell phones or home computers and be able to open up in June and offer telehealth visits as well as in-person visits. What I found very interesting was the changes in our community over the past few years. 4 or 5 years ago, many of our patients and clients would not have the technology on their cell phones in order to be able to do a telehealth visit. And we have found that the vast majority, they are able to access it through an app, which I think opens up possibilities for us in the future in terms of overcoming some of the transportation barriers we have. You'll see here the primary care clinics worked from home. They also did telemed through their office. We have Palmetto Breeze, who has kept getting people to their jobs, but also having to embrace new techniques and strategies for safety for both their employees as well as the public. We also had a number of partners very active in COVID testing. Beaufort Memorial tested over 12,000 people at the various practice sites, as well as several thousand people at free screening events that were conducted north of the Broad. Bluffton Jasper Vim also assisted with some sites in Bluffton area, and Comp Health has hosted a number of sites at St. Helena, Sheldon, clinics, and up in Hampton County as well. Next slide. So here's our village. So as I said, many of our partners kept on going through COVID-19, and we're working in ways to continue to get people qualified for the various programs. It's been interesting to see the level of flexibility and ways we're able to connect with people that a year ago we wouldn't have thought were possible. So just some quick updates from our partners. As I mentioned, 30 seconds. Okay. Beaufort County Drug and Alcohol has also implemented telehealth visits. They also have a program to assist people who may need financial resources for telephone and phone plans in order to continue to connect for care. Palmetto Breeze is continuing to provide workforce transportation. The community crisis response team going to be renamed as of tomorrow is the Mobile Crisis Unit. Pesos has been continuing to assist patients in the Latino community in terms of connecting them with other resources. They've also been very helpful in working with AccessHealth and reaching some patients where language is a bit of a barrier and there are urgent matters. And that's about it.
Great, thanks, Deb. Alec, if we go to the next slide. And we have Deborah Edmondson, who is going to be giving us an update on the Coalition for Aging in Place. Deborah? Is Deborah with us? Deborah, if you are here and we're having technical difficulties, if you would put something in the chat box and we'll know that you're at least here. Okay, I'm showing that Deborah is here and she's not muted, but we are not able to hear her.
Deborah, if you would just call in, I can provide you with the number.
Deborah, I'm being told that you need to switch inputs on your microphone, but if you're able to just dial in from a cell phone using the number Ben just gave you, that will work just as well. Okay, looks like Deborah is just about here. I think we got her. Deborah, is that you? I'm hearing someone. Whoever it is just sniffled. Oh, wrong Deb.
Hello, Fred.
Yes, okay, we got you. Now we got a feedback loop.
Okay. Can you hear me now?
Yes.
Okay. I'm getting some feedback. Is there any particular reason why? Oh, okay.
He says to please turn off your computer's audio
Okay.
or turn the volume down.
Okay, I did. I muted on the PC. Okay. Well, good morning, everybody. My name is Deborah Edmondson, and I am the facilitator for the Coalition for Aging in Place. I'm also the village developer, and our mission is to provide mature adults living in Beaufort County with a network of support that offers the practical means and confidence to enjoy life to its fullest in the homes and communities they value. And I always just like to add, as long as it's safe to do so. So when we talk about the villages, they're not structures, they're organizations within communities that will provide services for their neighbors. Currently, we have 3 villages in Beaufort County, in Rose Hill, Caring Neighbors. We have Sun City, Staying Connected, which I always like to say is our poster child. It's our largest village. And then there's also Safe Harbor on Hilton Head Island that now actually serves the island. They started out just serving sea pines. And so the villages offer light services. They'll stay in contact with care calls. They provide transportation, which is actually their largest service that they provide. Staying Connected has basically offered enough transportation services that their drivers have kind of been around the earth a couple of times since they've been in place. So, and that's providing transportation to doctors, to therapy, to the grocery store. One of the things that has been a result of COVID, that there are now more delivery services for groceries. So really the rides now are mainly for doctor's visits and therapy visits. And so what we do is we work with communities that are interested in starting villages, and we go in, we talk with the communities, we tell them that every community is unique. So they will have to provide the services that work for their community. It's all volunteer driven. Some of the villages are able to write grants to facilitate with insurances that are needed and any other expenses that they may incur. Sun City has been fortunate enough to be able to get donated space. They grew out of the space that they had on Sun City. So they're right outside of Sun City now. So as I said, each village is unique. And what we do is try to come in and help those put together the village that is right for them. We have a, what would I want to call this? We have a strategic session every June, and we didn't get to have it this year, but we're looking to do that in October. And we put up the items that we are really looking to try and take on as a challenge, because it's more than just village development. And one of the biggest things, other than transportation, is communication. So many of our residents just don't know what services are available for seniors in this area as they try to age in place. And so out of one of those strategic work sessions came a partnership with Anthem Media. And we are currently partnering with them to produce the Senior Resource Directory. The partnership affords the coalition several editorial pages and a couple of pages of advertising. And so we're always able to highlight one of our partners who sit around the table, and we're working now with the hospitals, with some of the hospices that are around. LCOG is involved. They're one of our partners. Of course, all the villages also have a seat around the table. So this is a way for the seniors to find out how they access services. And so the Senior Resource Directory had been mailed. At first it was distributed, and then the very next year we mailed 15,000 copies, then 20,000 copies, and we are on schedule to direct mail 30,000 copies for the 2021 edition. And we will also distribute to doctors' offices, the libraries. We have churches that are requesting copies of the directory now. So we're beginning to really get the directory out into the community. So those are our big initiatives. We also tried to produce events, and we had pre-COVID 3 events that were planned for this year. One was Spring into Step. The fire department did a presentation to us at the end of last year and talked about how many calls they have to make for seniors that are falling. And it's quite costly to the fire department. And so we thought that we would collaborate with them
Deb,
and
about 30 seconds.
Okay, and share with people what they can do to prevent falls and just overall holistic. It was scheduled for March. We had to cancel. We're going to reschedule that. We also will be talking about Medicare's new programs. That was going to be in May, but we will reschedule that. And then in September, we were going to have a presentation on the aid and attendance veteran spouses benefits. So those are just some of the programming things that we do in addition to the directory and village development. If anyone has any questions, if you're interested in joining the coalition, please give me a call. I believe my phone number is here in the feed, but it is 843-368-2483. And again, thank you for your time.
Thanks, Deborah. And also, just so you guys realize, this directory is not only in print, it's also online, which gives the coalition the ability to update it on a live. So if they have any changes or they want to add anybody, they are able to do that. And then the next time it gets printed, it's more current. Okay, up next, we have the Community Relations Council, and Chip Jenkins is going to be giving us that presentation. Chip, you've got 5 minutes.
All right, thanks so much. Good morning. So we at the CRC, or the Communications Council, Relations Council, this is our mission statement. Our mission statement is our mission is to create a beloved community by building bridges and celebrating our diversity and fostering more effective community relations, goodwill, mutual understanding, and respect among the residents of Beaufort, South Carolina. Discussions are held monthly, and they're open to all on the 4th Thursday of each month at 2 p.m. The length of the meeting depends on participation. Sometimes it's very lively and very passionate, and we love it. The monthly discussion varies in topics with a common goal of how do these topics affect our beloved community, and in what ways can we advocate and facilitate positive progression as a community. If we go to the next slide, it'll just kind of pinpoint our action teams. The first of our action teams is a New Paths project. This project started with a spark of an idea from our discussions. The Beaufort County Alcohol and Drug Abuse Department has agreed to house and assist in managing the New Paths project within their department. The CRC will still be apprised of all developments. The CRC will be sending their gratitude to those members that spearheaded this project. And that list is very long, and it includes Fred Lyda, Heather Price, Jim Gosselin, James Morale, and I am missing one other person. I will have to get back to that. I do apologize to you. The 21st Policing Task Force is our second action team, and that action team is spearheaded by Lisa Allen, who has dedicated countless hours to organizing and collecting many data points from the local law enforcement agencies to have independent review of arrest records made within the Beaufort County. The data is large and complex, but I'm happy to report that Lisa has gone through it all with her team of volunteers, and she is still calling for more volunteers to dig further into this data. But they're actually meeting tonight at 6 p.m. to go over what they have, and we're excited to hear what she's finding within that data. The last one is the community conversations team, which is a newly formed team, and they've met cyberly to discuss many ideas. The team came up with first running a 10-question survey among the community, try and figure out what topics would the majority of our community suggest is likely or to be most important to them. After that, the goal will be to narrow down to a couple of topics, and we're going to host a couple of live forums, and we're still trying to figure out what is the best way to deliver those. We're always looking for new membership throughout Beaufort County, and it's open to all, as I said. So if you just join us on the fourth Thursday of the month, that'd be great. All right, thank you.
Thanks, Chip. Good job. Next up, we have the Community Services Organization and Kimberly Hall. Kimberly, you have 5 minutes.
Hi, can you hear me okay?
Yep, can hear you great.
Hi, good morning, everybody. It's so nice to see so many friendly faces and get together with everybody and connect. So I'm the chair of the Community Services Organization. I'm also the executive director at Bluffton Self-Health. So admittedly, CSO has been a little bit dormant during COVID because a majority of our agencies are serving the critical needs of our community. The mission of the CSO is to bring about coordinated communication, accountability measures, and tracking information in a collaborative, efficient service environment in Beaufort County, and really to move the needle on those living in poverty in Beaufort County. So our main focus, you can go to the next slide, is the use of Charity Tracker. If you are currently serving folks in Beaufort County and not utilizing Charity Tracker, I would encourage you to do so. You can click on the next slide just to show a little bit. Anyone?
Alec, are you there? Next slide.
Thank you. The administrator for Charity Tracker is Barbara Bowers. Barb, I think she's on. I'm not sure if she's muted or not. Barbara, are you there? Is she muted?
I am. Good morning.
Hi, Barb. So Barb is our administrator, and really Charity Tracker helps us to regulate assistance that we're providing in Beaufort County. But what we're really trying to do, what Barbara's been working on the past 6 months, is increasing effectiveness and really regulating the use. We have a lot of non-users, a lot of users that have not been vetted. And so we've been working really hard. So if you are using Charity Tracker, you'll probably hear from Barbara very soon. There is sensitive client data in that system, and we're really interested in protecting that for the folks that we serve. If you go to the next slide. So this year alone, Barbara has worked to train 22 attendees and get 22 users up to speed with 6 agencies. But most importantly, we've done some case management, merged over 3,000 duplicate cases, and disabled 10 accounts. Like I said, the protection of that information is really important. If you go to the next slide, the goals really, like I said, is to increase the effectiveness of the data that's in the system. And that's really important that we double check who's in there, make sure that we're putting in accurate information, and expand the usage of it, getting more church groups, religious organizations, and folks that are offering that assistance onto Charity Tracker. And then increase the reporting and the usage of Charity Tracker, including how to, input outcomes and goals for the clients and things like that. So Barb, I wanted to turn it over to you if there's anything you wanted to mention or talk about.
No, just if people are not familiar, with Charity Tracker, they can email me, or if they want to train some of their staff or volunteers. So did you put my email address on the slides, Kim, by any chance?
It was on there. Fred, I don't know if we can maybe send that out afterwards.
It was on the first slide. So once the meeting is over and the whole session is recorded, anybody who wants to go back and look at it will be able to pull that information up.
I don't see it on there.
Oh, nope, you're right. It wasn't.
Yeah, it got taken off.
We now have it in the chat. So
okay.
Anybody who wants can look in the chat.
Okay. We have not met as an organization recently, so just be on the lookout for a meeting notice for a meeting hopefully coming up in Q4, and then moving forward into more frequent meetings into 2021. Thanks for bearing with us. A lot of our agencies have, like I said, been very busy. I know Second Helpings, Deep Well, many of the food providers and safety net providers in the community just have been overwhelmed. So thanks for bearing with us. And thank you to all of you to the support that you give this community, especially during a very, very critical time.
Kim, you have a question. The question is, there are a number of HUD and national programs distributing food. How are we recording these programs?
Thanks, Lily. I have no idea. I don't know how that's recording. I'm guessing it would go through Lowcountry Food Bank, but it would not go through the CSO. Perhaps we could chat about a better way for that.
Good idea. All right. Thanks, everybody. We'll move to our next. Alec, if you can go to the next slide. Our next coalition is the Disabilities Coalition, and we have Ann Carwath. Oh, keep going. There you go. Ann, are you there?
Hear me okay? Hello?
Yes, we can hear you, Ann.
Okay, great.
We
all right.
we don't see you, but we can hear you.
You can't see me? Okay. Hi, good morning. I'm Ann Carwath. I am the secretary of the Disabilities Coalition, and I've been a member for about 2 years, but I'm newly serving as the secretary. As you can see, our mission in the Disabilities Coalition is to enhance the lives of persons with disabilities in Beaufort County and the Lowcountry region by working together to provide improved as everyone has also experienced, we experienced a shock, bit of a shutdown during the COVID period that first hit us all. So we did not meet for about 3 months. But in July, we decided to take this setback. So we are back in full force. We have a renewed energy that we working with some of our past members who kind of have a new sense of energy and some new members. Plus members, they should be between educational, nonprofit, staff, volunteers. We have governmental agencies who are represented, and just in this area who all kind of work together to serve people with disabilities. One of our ways, go to the next slide, please. In our making a comeback out of a setback, we decided to refocus a little bit, and we have 3 areas of focus which have been with us since the inception of our coalition, and they're awareness, resources, and advocacy. Set up specific committees that would address those areas. It help keeps us more focused and kind of on our mission. So we now have committee chairs for each of those areas, and they're operating as sub chairs and meeting outside of our monthly meetings. And so we're going to be hopefully more effective, help our mission impact the people in a positive way. So as I said, energy is good. We springboarded this project that we had through a human service grant, which was a survey. And that survey told us that are not able to find or receive adequate services. So basically, we decided to, at the suggestion of Fred, create a comprehensive resource guide, including all the various services, agencies, nonprofits, anything having to do with providing services or programs or events for people with disabilities, very similar to what you saw with the Aging in Place Coalition. So we're very excited about this, and we hope that this will be a printed and a digital started this fall. Receive funding for that, and it would be in people's hands by early 2021. Next slide, please. So it's mentioned there. You can see it's going to encompass agencies, organizations, nonprofit groups, governmental, educations, and even businesses that source support for a person with a disability. We're also going to continue to work on some of our previously undertaken projects, and we're also going to more robust help people understand what's available to them and how they can actually advocate for themselves. We do work on their behalf, but we also want to create citizens who know how to advocate for themselves. So we're going to work on that. I guess that's our primary activities. We are, again, moving forward, hope that we can get this resource directory in place. And also we see a place where we can, and some room where we can collaborate with other human service agency groups who have some of the same concerns and issues that people within the disabilities community have. So we look forward to not only working within our group, but hopefully expanding beyond and working with some of you. Thank you so much for your time.
Next slide. There's the website. If you want to get more information, feel free to click on that and check them out. All right, Alec, if you'll go to the next slide, we have the Early Childhood Coalition and James Williams. James, are you ready?
Good morning. Hopefully everyone can hear me well.
Yep, we can. Now we can see you. Good job.
You can see me and hear me? Outstanding. Now, so Beaufort County Early Childhood Coalition, we are truly responsible for the future of Beaufort County. It is indeed an honor to serve on such a wonderful coalition, because we get to impact how our county will be in the years to come. The coalition is a collaborative effort. Obviously, we collaborate with Beaufort County School District, Beaufort County First Steps. It is a cooperation with the school district, DSS, Kappa, the Sheldon Township, all working together to improve and prepare our children of Beaufort County for success and health in school. As they're entering into kindergarten, first grade, to ensure that they are ready and prepared, not only mentally, but emotionally and in health and wellness as they enter into the school system. It is indeed a challenge with some of the communities that we have in Beaufort County. We talk about transportation, so we spoke about it earlier for the elderly, but for the children in some of our most rural areas, getting the necessary materials, items that they need to have a health and development is a difficult task. You know, using the resources, Together for Beaufort, we are opportunity to really impact the children within our community, within our county. The opportunity that we have in this collaboration is one that I look forward to growing through entities like this, and with the help of Fred, who I see this morning, he didn't put his cape on to wear for the meeting, but in a superhero-like capacity, bringing the county together to help support and grow all of the necessary entities that promote human services throughout the service area, not only Beaufort, Jasper, Hampton County, but all surrounding communities. It is indeed a task that is commended with Fred's effort. The many members that sit on this board, Ashley and representative from Kappa and from the Sheldon Township, as we grow, the school gives the entering test for grade levels as they enter to kindergarten and first grade. Currently, about 60%. I'll make sure I have that number right. 57% of the kids entering test at the average or above average in math, and about that same number, 57.4, test the same in reading. So our goal is to help improve those numbers, that the children can get into a higher percent and be prepared for their success in school. Any questions in the chat, Fred?
No questions yet. Alec, if you'll go to the next slide. There we go.
So, the universal staffing team is indeed a part of what we do. It not only connects with the children, but the first teacher that every child has is their family at home. So ensuring that the parents coordinate and have the things and tools that they need to help that child be successful is a very important part of what we do. So universal staffing, along with, is there another next slide?
The last slide.
Okay. So there again, I think this is a wonderful first step in getting out of all the coalitions that exist across our county. I was surprised to hear 120. That's a very large number, but we would love to see it to grow to even larger capacity. The more of us are working together to support our community, the better our community will be. But
thanks, James. Perfect timing. The alarm just went off. All right, next slide up, we have the Lowcountry Affordable Housing Coalition and Marilyn Harris. Marilyn, are you there?
Yes. Good morning. It's my pleasure to represent a coalition of over 100 diverse volunteer members. The mission, as you can see, of the Lowcountry Affordable Housing Coalition is to advocate for every Lowcountry resident to have an opportunity to live in affordable, safe, sustainable, and a sanitary home that costs no more than 30% of their gross income, including mortgage, utilities, and insurance. As I said, the Lowcountry Affordable Housing Coalition has more than 100 diverse volunteer members on its rolls and includes those who need housing, those who need employees, and those who wish to help alleviate the need, as well as banking professionals, real estate professionals, legislative members, and others. The members of the Lowcountry Affordable Housing Coalition continue to contribute to the collective impact of building an economy, a local economy that supports a sustainable quality of life through affordable housing. We accomplish this through training, presentations, community forums when possible, tracking of new housing constructed, meeting with municipalities and county councils, as well as Senate and congressional representatives to implement regulatory and direct housing incentives. We meet quarterly. We had our last coalition meeting in March with a presentation from Beaufort County School District's Ms. Akeisha Swinton, who spoke to us, who gave a presentation titled Homelessness as a Barrier to Education in Beaufort County. This helped us to meet our goal of providing education, information, and advocacy. Some of the members present included the Director of Community Services for Beaufort Jasper County, EOC, the Executive Director of a nonprofit in Hardeeville, the Director of Property Management for Atlantic Marine Corps Military Base Housing, a member of the Hardeeville City Council, a member of the Bluffton City Council, NAMI, Lowcountry Alliance on Mental Illness, a Senior Grants Administrator from Hilton Head, and others. Every time we meet, we have new presentations or new sharing from our different coalition members. So while our COVID-19 restrictions remain in place, the facilitator, and that would be me, continues to send out updates to our listserv. I recently, I guess I should say, started a new newsletter, and it's received positive feedback. So we're excited about that. I'm happy to answer any questions about the Lowcountry Affordable Housing Coalition.
Thanks, Marilyn. Good job. Next up is VITA, and we have Teresa Jackson. Teresa?
Can you hear me? Awesome. Good morning. Next slide, please. So, for those of you who do not know, VITA is the Volunteer Income Tax Assistance Program, and we provide free tax preparation assistance as it's noted here below. And as with the rest of the country, life as we knew it drastically changed in March of this year. And there truly was a mass panic and a lot of confusion for the majority of people who had not yet filed their taxes at that point. So we were inundated with phone calls, with emails from concerned taxpayers. So, and then also with the extension of the deadline to July 15th, and questions regarding the stimulus payments. And there was just this really overwhelming fear regarding taxes. I mean, death and taxes, right? Like the thing that, people fear the most. And so what we were able to do very successfully is create an IRS approved virtual tax preparation program. So this allowed taxpayers access to our certified volunteers through a confidential secured portal where they were able to still have their taxes prepared for them for free. And that obviously, from the comfort of their home, the volunteers, it was safe. But there's also, along the lines of that was there are a lot of, people that we serve that are not technologically savvy. And also part of this process was the AARP tax aid. And they completely ceased their services. So that really left a huge gap within the senior and elderly population. So we were able to pilot a program specifically in Sun City. I had several volunteers who were like, what can we do? How can we meet the needs? There's a lot of homebound folks that could really use the help. So we piloted a drop-off specifically in Sun City to meet their needs. And we were able to provide 65 returns, which, when you think about these are people who would have had to pay had we not been able to provide those services. Most of our sites, if you can go to the next slide, please. Most of our sites are located, we have an incredible relationship and partnership with the library systems. And again, with everything closing down, all the libraries closing down, and even when things did open back up, we were still not allowed use of the community rooms. So at the Bluffton Library, they have that large community room and they have the back door. So I was able to work with them, and we sort of had like a walk-up window. We placed a table out there at the back door. We had people walking up, again, being mindful, masks and whatever, hand things and so forth. But we were able to do 219 returns this way. So even considering all of the obstacles that we had to overcome this year, I had over 72 volunteers. They donated 9,000 hours of service. We have filed over 2,000 tax returns. And so even though we had to close our 11 sites, we had 3 drop-off locations, the 2 that I mentioned, as well as with Deep Well, and then the virtual program. So the economic impact to Beaufort County and the counties that we serve is pretty substantial. And again, saving taxpayers nearly $1 million in the tax preparation fees. And one story, in closing, is that I like to really be very hands-on, working with the clients that we serve and being present at the sites whenever I'm able to do. And I met with I happened to be talking with a young mom at one of our sites, and she had mentioned she was so grateful for VITA, and she had found out about what we do from her son's school. And she had shared with me that she was getting her taxes done, and my volunteer said, hey, what was you had happened to mention that your refund last year was $700. And unfortunately, she had gone to a paid tax preparer, and
You get about 30,
Pardon me?
you got about 30 seconds.
Okay, so anyway, her refund was supposed to be $3,300, and she only got $700. And so one of the biggest, priorities for me is getting out there and providing that financial literacy piece, letting people know that we are here to do this for free. Had she come to somebody like us, and what she learned that we were able to help her and get her full tax refund. So thank you so much.
Great. Good job. Thanks, Teresa. Next, coalition.
Increasing access is that most people don't know where to go for help. And so we need to be able to communicate that to them. There was a study done a while ago that showed that most people will go to their clergy for help. And while they may be able to offer comfort and solace, they can't really address the mental conditions that people may have, and our clergy don't really know where to send them. And so one of the projects that we set upon this year was to develop a brochure that we could deliver that, could you go back to my slide? Thank you. That we could deliver to doctors' offices, to schools, to the clergy, just letting them know what access that they have, what avenues that they have where they might be able to offer referrals to. So we set out to do that, and unfortunately what happened was it turned out to be more of a directory than really helping people provide access. And so starting next month, we're going back to the drawing board on that, and we're going to make sure that that brochure will make it clear that it's for crisis patients, make it clear about the severity of need, and make it clear that it is for professionals to use as a guide. And we're hoping to distribute those in addition to placing some strategically placed billboards around the area that will provoke thought on access to mental health services. We partner with NAMI, with Crisis Intervention, the South Carolina Department of Mental Health. We also have been fortunate this year that the Tenet hospitals have come to the table to join us. In addition to that, law enforcement is coming, and they're all helping us put together this brochure because each of those entities have found that there is a strong need for that. So that's going to be our major project coming up, a grassroots marketing program, again, just letting people know what their options are as they seek services for mental health.
Great, thanks, Deborah. Next up, we have the Military and Veteran Services Alliance with Rob Bridgers. Rob?
Can you see me or hear me now?
Yes, I can hear and see both of you.
Oh, well.
Oh, Connie just got
Good virtual morning, everybody. My name is Rob Bridgers. This is my boss, Connie Hip here. Come on over. We represent MAVSFA, which is a acronym for Military and Veteran Service Alliance. We exist to provide a single source of information that a military service person, veteran, retiree, or any of their family members can use to access information, assistance, and any other type of services that they need here in Beaufort County. We are a coalition of approximately 50 organizations, and we cover all what we have identified, all the needs from health, physical or mental, to housing, employment, education. And we meet basically once a quarter to compare notes. And we've not been able to do that since January due to COVID. At some point in the future, we're thinking first quarter, we'll meet again. We have, in the absence of any meetings, have met personally with the new Secretary of Veteran Affairs, retired Major General Will Grimsley, and he has expressed interest in talking with our group. We've had a few virtual meetings with Joe Cunningham. So the interest for serving the veterans and the military population exists at all levels in our government, and we're trying to plug in and connect with it. We have one of the things that we're very proud of. We've been able to produce a military service or veteran service guide. Matter of fact, that's a picture of it right there. We had 15,000 printed. 5,000 were mailed out through a major list. We have personally distributed over 5,000, and 5,000 remain in storage. We've also got a virtual version of it. The address for that would be militaryvetguide.com, and it's kind of a work in progress. You can access it anytime any information and new organizations joining it update and put their information to it. The population that we serve, as the slide indicates, is there are over 20,000 veterans. I think that number is a little low.
About 30 seconds more, Rob.
Okay, well, it's been nice talking to everybody. Enjoy the rest of your COVID vacation, and we'll see you on the campus.
Thanks. Good job, Rob. Next up, we have the Pathways to Parenthood.
5 minutes.
Hi, Fred. It's Katie Godowns. How are you?
Great. You got about 5 minutes, Katie. Go for it.
Sounds good. I think I'll take 3. Our Pathways to Parenthood Coalition's main goal is that all pregnant women in the Lowcountry would receive adequate prenatal care for them and their child. Our coalition consists of human service professionals and healthcare providers, both for-profit and nonprofit. Some of those include, but aren't limited to, Beaufort Memorial Hospital and Birthing Center, Beaufort County Alcohol and Drug Abuse Department, South Carolina DHEC, MUSC, local doulas, Beaufort Jasper Comp Health, the Pregnancy Center, Stork's Nest, March of Dimes, and the list goes on. We're always growing, inviting new people to the table, anybody who would like to meet. When our coalition was formed in 2006, I wasn't there, but in 2006, Beaufort was ranked 45th out of 46 counties as it pertains to mothers receiving adequate prenatal care. In February of 2019, we were ranked 21, which is a lot better than 45th, but we're still working on that. As a coalition, we have been working on a website to launch to the public that would help put like a resource guide together for moms and families on their path to parenthood. We realize that it could be an overwhelming amount of information at an emotional time in life, and everyone receives you're expecting different. We have military families here. We have teens that are finding out that they're expecting. We have, just different walks of life finding out at different times. And we thought it would be nice if we could put all of the resources available in one central location. So we are working on a website. It's called BeaufortBaby.com. It is not public yet to the public, so please do not try to share BeaufortBaby.com yet. It is not 100% ready. But back in March, we set out a final document to all of our existing members to try to get their services plugged into the best spot on our website. We tried to break it down instead of trimesters or gestational ages. We tried to break it down so anyone reading it could understand it. So it would be before baby, during pregnancy, and after birth. We just want to make sure that the moms are receiving the care that they need while they're pregnant, and the babies as well. The website will also give us availability to add events that are going on locally. So for an example, if Beaufort Memorial was hosting a birthing class, they could click on the event calendar, click on the class, and it would redirect them to the provider's website. So we will just be a resource guide. We're not pushing any of these services on anybody. We're just trying to get all of them in one spot, so it's not overwhelming for the expecting family. So adding events will be one of the things that we will be doing. And then it will also have an instant pop-up that will ask the web user if they're registered for Stork's Nest. And if you're not familiar with Stork's Nest, it's an incentive program for moms or families to receive prenatal care. It's through Zeta Phi Beta sorority and March of Dimes. The expecting family would get their doctors to sign off on their appointments. And in return, they would get free diapers, breastfeeding supplies, those sorts of things. Due to everyone figuring out their new normal and a lot of our members being healthcare providers, we have not met yet, but we plan to do so virtually. Our secretary stepped down, so we will be in the process of trying to find a new secretary and figuring out how to meet virtually. But if you're interested in meeting with us or possibly getting your services put on Beaufort Baby, if you'll reach out to me, my email is kgodowns@bcgov.net.
Great. Thanks, Katie.
You're welcome.
Next up, we have the Water Quality Coalition and Denise Parsick, our Water Commissioner. Denise? All right. Let's go ahead, go through these slides, and hopefully while I'm wrapping up the meeting, Denise will be able to come back on and we can back up and let her do her piece. Next slide. And one more. And one more. Okay, that is the last presentation that we have scheduled for today. We are going to give an opportunity for you all to communicate with each other using the chat. One of the things that people tell us every time we have a alliance meeting is that one of the biggest advantages is the networking that takes place as folks get to meet each other. And since we can't do that physically, we are going to keep this chat open for about another 30 minutes or so. And you all will be given the opportunity to enter a chat message that everyone else will be able to see. So we'll take the time now to let everybody communicate with each other. And last thing I wanted to bring up is the encourage everybody once again to think about joining one of the coalitions that you've just heard about. If you're interested, if your organization is could impact that population or that issue, by all means, please reach out to Ben, and he can connect you with the appropriate representatives from the coalition that you might want to work with. Before I sign off, I want to ask Ben if there's anything else that he can remember that we needed to bring up, as I always do at the end of a meeting. Ben?
No, I think that's everything. I appreciate everybody who emailed me and sent me questions. If I've missed anything, please feel welcome to follow up with me. My information is right there, and I will hang out in the chat for a little bit longer to help address any other questions. Thank you.
Looked like we had a question about joining. I think it said something about, can you be an individual? An individual can join a coalition, and an individual can join the alliance. You don't have to be part of an organization. You can be a private individual. Since all of the coalitions are made up of volunteers who choose to come together on a regular basis to try to address a particular community issue, you don't necessarily have to represent an organization in order to do that. While we give everybody an opportunity to send any more kind of chats to share across the group, I'm going to see if I can call Denise on the phone and find out if she's going to be able to join us. Ben, if you'll continue to monitor the chat in case there's any other questions. Folks, so I just spoke with the Water Quality Coalition representative, and they were all set to join us, and they were listening and could hear everything that was being said until we got just to the point where it was their turn, and then they lost their connection. So they're going to put something in the chat box here in a minute, and you'll all be able to follow up with them through that. They send their apologies. Denise had to leave to go to work. Shelby, can you give them a point of contact in case anybody else wants to follow up with that coalition? All right, we haven't had any chats here in the last few minutes. Oh, wait, there we go again. All right, thanks everybody. I appreciate you all taking the time to be here. To all of our presenters, thank you very much. You did an excellent job. I think this is going to be a really good tool for all of us to use. I know that for my office, the entire broadcast is going to be a great opportunity when we need to tell new community leaders who have come into town. We get calls from folks all over the country asking if they can replicate the kind of work that we've done in this community. And so this recording is going to be an excellent way for us to share with them all of the specifics and details about the various coalitions and the work that's being done by our network. So thank you all very much. Appreciate your time. And everybody have a happy Halloween. We'll see you in March.